Hey there, my name's Chris, and today in this video we're going to be reviewing the wound dressing change. Now you can use this video to brush up on your skills, as well as prepare for the upcoming validations that happen annually. Without further ado, let's go ahead and dive right in. The first thing that you'll want to do is to check the physician's order, as well as review previous assessments and notes to establish a background understanding of this wound. Then we'll want to perform the beginning 5, which would be to assemble your equipment, knock on the door, identify the resident, explain the procedure and provide privacy, as well as perform hand hygiene. The equipment that you'll need for a wound dressing change are gloves, 2 pairs and sterile if ordered, fresh dressings, tape, a plastic bag for disposal of soiled dressings, solution to clean the wound, and gauze wipes. Once the resident is comfortable, you can then put on gloves, and then we'll start to remove the dressing. So what we want to do first is to loosen the tape from the resident's dressing, or we can press down on the surrounding skin gently and carefully to lift one edge of the dressing from the skin. You'll want to continue to carefully lift the edge of the dressing from the skin by moving slowly around the ulcer margins until all edges are free. For residents with particularly fragile skin, we can use a product designed to loosen adhesive to protect the skin from tearing and also provide the resident more comfort with each dressing change. We'll remove the dressing slowly, folding over itself and pulling it in one direction in the direction of the hair growth. If the dressing is difficult to remove, we can loosen the edges with a warm, wet cloth. You'll then remove the soiled dressing and discard it in a plastic bag. We want to be careful to avoid contacting with any other surfaces to avoid contamination. You can then remove your gloves and discard those gloves in the same plastic bag and perform hand hygiene. Next, you'll create a field with your equipment wrappers, and you can use sterile technique if required. You'll open all your supplies and pour the solutions if ordered, and then, once your area is prepared, put on your gloves. You can then assess the wound and the surrounding area to ensure that the selection of the appropriately sized dressing is correct. Then cleanse the skin and the wound thoroughly with normal saline using gauze wipes, wound cleanser, or ordered antiseptic solution. You can also clip excess hair at the site as needed. You'll want to allow the skin to dry completely before applying the dressing. If the resident's skin is fragile or drainage is expected to go beyond the wound edge, consider applying a skin protectant around the wound. You can then remove the dressing from the inner wrapper, avoiding finger contact with the dressing. Position the dressing over the wound and press down gently on the skin. Firmer pressure can be used on the edges depending on skin condition. Sometimes a rolling motion is helpful, and we want to avoid unnecessary stretching of the dressing to keep the dressing's integrity intact. You'll then place all disposable items in a plastic bag with the dressings, the seal, and discard according to procedure. You'll then want to perform the ending 5, which is to remove your gloves, perform hand hygiene, leave the resident comfortable, place the call light within reach, and then document where/when appropriate. You'll write down the time, the date, and your initials on the dressing, and chart dressing change and wound observations on the wound data collection tool. If the RN needs to assess due to a change in the wound status and/or review the treatment choices, documentation should be completed on the wound RN assessment.